Welcome to this EduCare course titled Infection Prevention and Control N95 Respirator, Protecting Healthcare Workers. My name is Ethel McClinsky. I'm an RN and I will be your facilitator. Information presented in this module is based on recommendations and directives from the Center for Disease Control, or CDC, and Occupational Safety and Health Administration, or OSHA. This course is designed to teach you about respirators, particularly the N95 filtering facepiece respirator. We will ask you to state the purpose of the respirator, describe how to apply the N95 respirator for a correct fit, and finally, to name resources for ongoing learning. A respirator is a type of personal protective equipment that is worn by healthcare workers as well as other workers. Respirators can cover a large part of the face, but at the very least are worn over the nose and mouth. An N95 respirator is used specifically in healthcare to reduce the healthcare worker's risk of inhaling small, hazardous airborne particles. For the purpose of this training, we are going to focus on the use of the respirator N95. Respirators are not ventilators, or those devices that assist sick individuals to breathe when they are unable to breathe on their own. The most important difference between a respirator and a ventilator is that, unlike a ventilator, a respirator does not perform any actual breathing function for its wearer. Instead, the respirator's purpose is to purify inhaled air before it enters the lungs by trapping harmful particles and fumes. Respirators are not to be confused with the more standard and common surgical or regular face mask, widely used in healthcare settings. The photo shows a surgical mask on the left and a respirator on the right. Both respirators and surgical masks are personal protective equipment, PPE, devices, and both are worn over the nose and mouth. Both are used for infection control. That is where the similarities end. Surgical masks create a barrier for splashes, droplets, and spit, whereas respirators protect from exposure to airborne particles, including viruses and bacteria. Respirators are designed to seal tight to the face of the wearer. Surgical masks do not fit tightly to the face. A respirator is used to protect the wearer from airborne infectious agents. The airborne infectious agents healthcare workers may be exposed to include tuberculosis or TB, chickenpox, measles, and pandemic influenza such as COVID-19. The most common type of respirator used in healthcare is the N95 FFR. An N95 FFR is a type of respirator that removes particles from the air. These respirators filter out at least 95% of very small 0.3 micron particles, hence the number 95. FFR stands for Filtering Facepiece Respirator. The N95 FFR is capable of filtering out all types of particles, including bacteria and viruses. The N95 FFR respirator fits tightly over the nose and mouth. This allows all air brought into the wearer's body to be filtered through the mask and have infectious agents trapped before entering the wearer's mouth or nose. The photos on the top show the N95 respirator front and back before it is opened. The bottom shows the mask open and ready to apply. The use of N95 respirators requires an assessment of the worker's specific work environment by the employer to determine if hazards are present or likely to be present. Each employer, as part of an overall infection control and occupational safety program, will determine if the use of N95 respirators is required and in which situations they will be used to protect the healthcare worker. Once it is determined that respirators, specifically N95 respirators, are going to be used to protect the healthcare worker, the following steps occur. First, it must be determined if the healthcare worker is medically able to wear the mask. Second, specific training is put in place for when and how to use the respirator. And finally, the respirator is applied correctly to assure a tight seal. Each healthcare worker who is required to use a respirator must, first of all, be medically able to use the device. What do we mean by medically able? By medically able, it means there is no healthcare concern that would prevent a person from using a respirator. Some conditions that would prevent a person from using a respirator include heart conditions, lung disease, and psychological conditions like claustrophobia. If airborne hazards are present, or likely to be present based on the hazard assessment, the employer or infection control practitioner will select appropriate and properly fitted respirators that will protect workers from the airborne hazards. This includes specific training on the infectious disease and which respirator will be used to protect the healthcare worker. This guidance is provided by the State Health Department and the Centers for Disease Control to the employer. Recommendations are provided about respirator use and other precautions to protect the healthcare worker. Once workers who are required to wear respirators like the N95 are identified, a respirator fit test is performed. This fit test is performed with the same model, size, and style respirator as the worker will actually use in the workplace. The fit testing method used is determined by the manufacturer of the N95 mask. Instructions and a kit for testing is most often obtained from the manufacturer of the respirator. Many of the fit tests are done with what is called a qualitative method. The fit test uses the person's sense of taste or smell, or reaction to an irritant in order to detect leakage into the respirator facepiece. The testing does not measure the actual amount of leakage, it simply identifies if there is leakage. In this qualitative method, the sensitivity of the testing agent that is used for taste or smell is tested with a healthcare worker to determine if the worker can indeed taste or smell the agent. Then the healthcare worker puts on the selected respirator. The healthcare worker secures the respirator over the nose and mouth to assure that the respirator is properly seated on the face and provides a tight seal. Next, the wearer enters an exposure chamber, has a test enclosure placed over his or her head, or is positioned somewhere in an open test area. The test agent is generated at the designated test level around the wearer. The fit test operator observes the wearer during exposure to the testing agent. The wear of the respirator is directed through a series of movements that mimics movements in the work setting. The fit test operator notes involuntary coughing during the test or notes if the wearer smelled or tasted anything at any time during the test. From the wearer's response and the fit test operator's observations, the fit test operator determines if the respirator that was tested is effective and may be assigned to the wearer. If the wearer does smell or taste anything, then the respirator tested is not effective. The entire test can take 15 to 20 minutes or until an effective respirator and fit is determined. In times of pandemic, when many healthcare workers need to be fit tested quickly, facilities may elect to implement the just-in-time method for fit testing. Just-in-time fit testing is a way to fit test large numbers of workers at one time. An experienced fit test administrator may be able to fit test 5 people simultaneously. This method works by having a fit test administrator fit test 5 people while simultaneously training them to also be fit administrators. Those 5 people can then conduct fit tests for the remaining staff. The first thing to understand is that the number of fit testing kits purchased should not be based on the number of fit tests that can be conducted per kit. The number of tests is primarily limited by the amount of fit testing solution available. Many suppliers provide kits using saccharin and Bitrex in a 55 milliliter bottle of strong solution. A 55 milliliter bottle is advertised to test 150 people. However, nebulizers need to be emptied, rinsed, and refilled every 4 hours. This decreases that number significantly, and facilities should consider ordering extra solution. A person with facial hair may have a difficult time obtaining a correct fit, and facial hair along the seal lines of the respirator will cause the respirator to leak. The person must be clean shaven, especially along the seal lines. In addition, a person with long hair or sideburns that gets under the mask can cause a poor fit. Be sure that hair is not trapped under the mask. The mask must be molded over the nose to assure a tight fit. Gently push down both sides of the nose piece at the same time to promote a tight fit. Bottom line, it is imperative that the respirator fit tightly to assure that infectious airborne agents are not inhaled around the mask into the mouth and lungs of the healthcare worker. Because each brand, model, and size of the facepiece N95 respirator will fit slightly differently, a user should engage in a formal fit test every time a new model, manufacturer type or brand, or size is worn. Also, if the user's weight goes up or down significantly, a fit test should be done again to ensure the respirator remains effective. If there is a change in facial hair, a fit test may be required. Otherwise, fit testing should be completed at least annually to ensure continued adequate fit. Are all brands of respirators applied the same way? No, that would be too easy. That is why it is important that healthcare workers always consult the manufacturer's user instructions before putting on a new brand or model of respirator. Typically, for N95 respirators, the proper placement of head straps means that the lower strap should be worn around the neck and below the ears. The top strap should sit above the ears and around the crown of the head, securing the filter piece to the user's face. The facepiece should feel snug. On most N95 models, the nose piece is meant to be molded to the user's facial structure, using his or her index fingers of both hands to press gently against the metal strip until it molds to a snug fit. See the next slide for a video demonstration on applying one type of N95 respirator. Once a respirator is applied, a user seal check is completed every time the respirator is worn during a work shift. A user seal check is performed by the healthcare worker and is accomplished by following the manufacturer's recommendation. This information can be found on the box or individual respirator packaging. There are positive and negative pressure seal checks, and not every respirator can be checked using both. You should refer to the manufacturer's instructions for conducting user seal checks on any specific respirator. One example of how to test a seal is to use a positive pressure check. Once the respirator is put on and applied tightly over the face, the mask is ready to be tested. To test, put your hands over the facepiece, covering as much surface area as possible. Exhale gently into the respirator facepiece. The face fit is considered satisfactory if a slight positive pressure is being built up inside the facepiece without any evidence of outward leakage of air at the seal. Examples of such leakage would be the feeling of air trickling onto your face along the seal of the facepiece, fogging of your glasses, or a lack of pressure being built up inside the facepiece. If this occurs, the mask is not fitting tightly. Readjust the mask and try again until the mask seals. If the respirator has an exhalation valve, then performing a positive pressure check may be impossible. Instead, a negative pressure seal check is used. To conduct a negative pressure user seal check, cover the filter surface with your hands as much as possible and then inhale. The facepiece should collapse on your face, and you should not feel air passing between your face and the facepiece. Please see the video to show how to complete a positive pressure check. Next, let's review the order you are applying the respirator when you are using it with gowns and gloves as part of your PPE. When using a gown, respirator, and gloves, you will apply them in that order after washing your hands. First gown, then apply the respirator or surgical mask, and finally gloves. In some cases, you will leave the respirator on at all times and only change the gown and gloves when leaving and entering an affected person's room. And in rare situations, when you may experience splashes, you may also be required to wear a face shield over the respirator. When removing the gown, gloves, and respirator, it is important to remove them in this order. First, remove and dispose of your gloves without touching the outside of the gloves. Then remove your gown, again without touching the outside of the gown. With your bare hands, you will reach back to untie the gown. Then roll the gown from the back, turning the gown inside out and away from your clothing. Dispose of the gown in the appropriate receptacle. Perform hand hygiene by thoroughly washing your hands or using a hand-based sanitizer. When removing your N95 respirator, you must follow this protocol to prevent contamination of your hands while removing the device. It's important not to touch the front of the respirator. First, tilt your head forward. Then, using two hands to grab the bottom strap, pull the sides, then over your head. Next, use both hands to grab the upper strap, pull to the sides, then over your head. Keep tension on the upper strap as you remove it, which will let the mask fall forward. Dispose of or store the mask as per organizational policy. In certain situations, N95 respirators can be reused. Reuse refers to the practice of using the same respirator multiple times during a work shift or for the entire shift. The respirator is stored between uses and put on again prior to the next potential exposure. Respirators should only be reused by the same wearer and should be stored according to manufacturer's recommendations and in a way that protects it from damage or contamination. Please remember to avoid touching the outside of the respirator as this could contaminate you. If you inadvertently touch the outside, remove your gloves and wash your hands for the full 20 seconds before applying new gloves. Regardless of the setting, the number of times a respirator is used should be limited. The National Institute of Occupational Safety and Health reports there is no way of determining the maximum possible number of safe respirator reuses. Congratulations! You have learned how you would assure proper fit and use of the N95 respirator. The next step is to use the respirator appropriately in your setting. Your organization and supervisor or infection control practitioner will give guidelines on when to use the respirator you have been fitted for, where they are stored, and how you will dispose of them. In addition to this training, there are many resources available to answer your questions about respirators. First, seek answers from your supervisor or employer. Make sure you understand what is expected of you in terms of how and when to use the respirator. Assure that the respirator you are using is a right fit, using a fit test. Follow manufacturer instructions either from an insert with the package or by viewing a video. The Center for Disease Control, or CDC, has excellent material online about the use of respirators. Occupational Safety and Health Administration, or OSHA, as well as the National Institute of Occupational Safety and Health, also provide extensive online resources. Use these resources to learn more on how to protect yourself as a healthcare worker. This course has described a respirator and how it is different from the common surgical mask. We have shared the purpose of the respirator and when it will be used. We have described how to be sure that there is an appropriate fit of the respirator. And finally, we have provided resources to learn more about N95 respirators. We hope you use this information to stay well as you care for those with airborne infections. Be well! Thank you for your time and attention. Please take the knowledge assessment that follows this course and contact your supervisor with any questions or comments.